All right, we're going to go ahead and get started. Again, thanks everyone for taking time to hop on the call with us today. Share, our process will be to kind of share some updates. We'll review the data initially, and then I'm going to kind of turn it over to Sarah. Hopefully she's on to share a little bit on the testing process, and then Brett, I'm assuming you want to share some stuff on our vaccine planning. And so we will go from there. So I guess let's do the data part of this first. Jordan, are you on?
I'm here.
Okay, I'll turn it over to you then for the data.
All right, I'm gonna share my screen first with the new spreadsheet that we started sharing with you guys, and I will have Brett email this out again. So all of our counties remain in county risk level E, which is the highest level. Our daily cases per million has gone up a little bit since our last report, but nothing too major. And that does change daily. So if we check tomorrow, it could be back down to that 360. For the cases weekly trend, there was a change this week on the back end where I get this information from. And the indicator was either decreasing for less than 2 weeks, decreasing 2 to 4 weeks, or decreasing for more than 4 weeks. So I just put a little note about that on the bottom there of what those numbers mean this week. And our percent positivity still remains around 13%. So while I go through the rest of the information, I'll just leave that up. We reported 249 new cases from Friday at 3:01 p.m. until yesterday at 3 p.m. There were 785 new cases over the past week, Tuesday to Monday, and the week before that there were 893. So we have seen a 12.1% decrease in cases over the past week, which is encouraging. Our total number of jurisdiction-wide cases as of yesterday was 8,361. And over that time period, cases have been identified from the same things I've been telling you: school exposures, household exposure, care facility workers and residents, healthcare workers, social gatherings, including religious services, recent travel, pre-surgical testing, community contacts, and other worksite exposures. Cases by county as of yesterday are Crawford with 402, Kalkaska 419, Lake 252, Manistee 482, Mason 756, Mecosta 1,460, with Ferris State reporting 516 cases, Misaki 364, Newaygo 1,956, Oceana 1,437, and Wexford 833. In the past 6 days since we last reported to you on Wednesday instead of Tuesday, there were 11 deaths and 696 people recovered. Today there are 14 positive inpatient cases at Munson Cadillac, 11 at Munson Grayling, 1 at Munson Manistee, 12 at Spectrum Health Big Rapids, 7 at Spectrum Health Gerber, and 5 at Spectrum Health Ludington. That's what I have for you today.
Okay, thanks, Jordan. Okay, any questions for Jordan on the data? All right. Then before we kind of get to Brett and to Sarah on the testing part, just a couple other things. Obviously, we do continue to work on answering questions, working with our schools and the courts, and the enforcement aspect of this, of the epidemic orders, primarily with restaurants. And then we also have begun the process of planning for vaccination, and I know Brett's gonna talk more on this here in just a second. But just so that you guys know, we are not receiving any of the initial shipment of Pfizer vaccine. So we will be waiting for the Moderna vaccine to come in, and we expect that to be in next week if everything goes as planned. And so thinking of starting our vaccination process probably that week between Christmas and New Year's. So just so you understand that, some places are getting Pfizer, but we are not getting Pfizer. And I'm sure Brett's going to talk more about that as he kind of provides an overview of our vaccine planning process. So Brett.
Okay, so for those of you who may not be aware, the first phase, the first priority groups are hospital staff, long-term cares, and all the groups that are associated with that. So those who might not have been on when I was talking to Denny, it's the assisted livings, adult foster cares, all those types of group facilities or homes. And then EMS staff and medical first responders. So it's the MFRs with the fire departments. So that's the first group that will be getting their vaccine. And like Kevin said, our intent is to utilize the Moderna vaccine. We currently do not have that. We haven't received a shipment yet, but our intent is that week of the 28th to begin the EMS and the MFR vaccinations, because the hospitals are getting their own, so they're doing their own staff, and the state has contracted with a couple of chain pharmacies to then go in and do the long-term care. So hospital and those long-term care groups, for the most part, should be taken care of not through the health department. We may have to follow up and catch some of the gaps, but primarily our first push is going to be EMS and MFRs in our clinics. So I have been working with our 10 county emergency managers. So through, every other day type of emails. So we're looking for them to assist us with reaching out to those fire departments and those EMS organizations in their particular counties. So we're looking for things like numbers of staff that will need to vaccinate. The other piece of that is we are also asking them to assist us with finding drive-through locations. So not to get too far in the weeds, but for many years, we've had what we call a mass clinic plan, and the name's changed over the years. It's currently now a pod, point of dispensing, but it's for the most part, 8 of our 10 counties use road commission buildings. So that's a system we've had in place that we could drive cars in, 20 at a time, vaccinate them, and they roll out while another 20 come in. But in this type of event, we're also looking for what I'm calling medium drive-throughs. So it's the handling 3 or 4 cars at a time at like a fire department, or we've had a superintendent offer up his brand new 4-stall bus garage. So utilizing those type of facilities to do 3, 4, 5 cars at a time, because it wouldn't be the several hundred at a time we would need if we were doing general population. So all of that to say, we've reached out to those emergency managers to help us kind of identify, and there's some criteria we want to meet, and we're putting together a list of where we would potentially be able to use those fire departments or bus garages to do the vaccine as we move through these various phases of the priority groups. And I think that's basically all I have as an overview.
Okay. Anything for any questions for Brett on anything related to the vaccine planning part of this?
Hello, Brett. This is Mark with City Manatee Fire.
Go ahead, Mark.
Okay. I was doing some research and reading, and one of my concerns is rolling out our entire department in one vaccination. I was looking at trying to do it in 2 series, just to be on the cautious side, that if anyone were to have any type of reactions or that I wouldn't be down multiple people. Not saying that everyone will have a reaction, but I'm just trying to be on the cautious side. Will that be available in a bi-weekly or some type of rollout that will span the time for delivery?
So the short answer is yes. We understand that is a potential problem for various groups. So it's really going to be more along the lines of you as an individual agency to figure out who that's going to be and then send them to the clinic. But I envision that, and again, nothing's set in stone at this point. We have internal teams, a vaccination group working on when we're going to offer clinics and how often and where they're going to be, all that kind of stuff. So that is currently being worked out. But my understanding is that we would offer multiple options for you so that you could do shifts of staff. Not saying you'll have the opportunity to do it, a little bit today, a little bit tomorrow, a little bit the next day, but I would have to believe we will be able to work with you to at least do it in, half at a time, kind of a thing.
Half at a time. Exactly. That's what I'm looking for. Thank you very much.
Yep. And just to kind of add to that, just so the group knows, right now we are looking at probably doing both walk-in type clinics, so like at our health department office, and at the same time utilizing those drive-through clinics that I just talked about. So as an example, in a given county, if there are only 12 EMS people getting vaccinated, it's probably just as easy to run them through our office versus going and trying to set up a drive-through clinic at a fire department. So our internal team is trying to assess all of that, and they'll make the determination on which group is going where or how we're going to offer up that vaccine based on the numbers in the particular groups that we're looking at.
Brett, this is Wayne Beldo from Maple Grove Township. Is there going to be some education on what the side effects may be, or the occurrence of side effects, or anything like that? And will EMTs have the right to refuse a vaccine the first time around?
So the answer to that, both those is yes. So what I would envision is our communication team would be providing general communication to the public and through our internal channels, our Gov delivery, our website, that sort of thing. So I haven't confirmed that with them, but I would assume that they would be providing that information as a general education piece. Then the other piece of that is that as part of the vaccination process, they will be receiving that information. So, an educational sheet, potential side effects. There's also, just so you're all aware, there is a adverse events reporting system. So those types of things, information about how to do that will be provided to the people being vaccinated. And then to your point about refusing vaccine, and Kevin, correct me if I'm wrong, but my understanding is that because this is an emergency authorized use, so an EAU, that because it has that designation, that my understanding is nobody can be required to get this vaccine.
Correct. Yeah, it's not advisable for this one. That anyone is mandated to get this. And just another point on the education part of this, some things that we're working on. Dr. Morris, our medical director, she was on last week's call and provided an update on the vaccine. She actually is in the process of creating 4 different video segments that we'll be able to provide links to so that individuals can watch them. The first one is going to be on research, development, and monitoring of the safety of COVID vaccines. The second one is going to look at a review of the Pfizer vaccine. The third one is going to be a more in-depth explanation of what an RNA vaccine is, which is both the Moderna and the Pfizer vaccine. And then the last one is going to focus in on questions and myths associated with the COVID vaccine. So looking to try to get those completed within the next week or so, and then we would send out information on those and how people can access them, so that if that was something that you were interested in doing, you could do that whenever it's possible.
Thank you.
Yep.
And then Kevin, I see a question from Josh that I can answer. It says, when will vaccine be available to law enforcement? So the answer to that is law enforcement falls under the essential worker category, which is 1B. So basically what that means is after all of the healthcare related fields are vaccinated, then we move into the essential workers, and that's where law enforcement would fall. So I cannot give you a specific date or even basically even a time frame, because it all depends on how much vaccine we get and how quickly we can get those groups ahead of the essential workers, so the healthcare fields, how fast we can get them all vaccinated. And keep in mind, we have to give 2 doses. So in effect, that doubles the time that it's going to take us to get through those groups, because we have to give everybody 2 shots. So like I said, it could be, I think I had someone else email me that question, and my answer was it could be February, it could be April. Now I'm assuming it'll be a lot quicker than April, but I'm just saying there's really no way to actually tell.
Okay. Other questions on the vaccine process overview that Brett provided? All right. The next piece then, I think, Sarah, are you on?
May I ask a question, Kevin?
Sure.
This is Joseph Fox.
Yep.
So would the COA workers fall in that same category then Brett, as police?
I'm sorry, I missed the first part of your question.
Would the Commission on Aging workers fall in that same 1B category? We're having contact with older adults daily.
I am guessing yes, because so 1B is called essential, and then the next category is 1C, which is individuals 65 and older and individuals 18 to 64 with like chronic conditions. And then it's everybody else. So yes, I'm assuming those would fall in that 1B essential category.
And will you guys contact us, or are we going to have to kind of keep our ears open and contact you?
No, so what kind of my standard response to that question is that the health department will work with county administration, emergency management, and all of our partners within the county to make that happen. So no, it's not something where you need to contact us. We are not keeping lists and dates and people. It's going to be when we're ready for the next group, we will make sure through our community channels that you guys are notified that you're up.
Okay. And then finally, just a comment, if you need space, we have space here at the Commission on Aging. If you needed a large group of people to get in line, and then we have separate spaces where you can do the vaccines and what have you. So feel free to let us know.
Okay, thanks for that offer.
Yep.
Thanks, Joe.
Yep.
Okay. Other questions? All right. Then Sarah, or did you get on?
I am.
Okay. Then I'm going to go ahead and turn it over to Sarah, and she can talk a little bit more on the testing process with the antigen testing cards.
Yes, Brett actually forwarded that group or that message out to all of our emergency management and requested that you pass it on to your local EMS. I believe we've only had one packet yet, or one request from an organization. Don't ask me which one, because that's just too hard to think about, but we have not gotten a great response. But the kits are here, and we can get those in your hands if you are interested. If you need me to email that back out or Brett forward it, I can email it to the full group if you'd like, if that would help. We have been working with our adult foster care homes and our homes for the aged, and sent out, I believe, 150 introductory emails, and are getting a lot of response in that area. But that's based, unless people have questions on the kit that went out.
And again, these kits do expire. And so I believe the expiration date on our first supply was the end of March. And then the second shipment that we got was kind of like the middle of April. So if this is something that you're interested in, we'd encourage you to take advantage of it soon. Okay. Any other questions? Okay. Thanks, Sarah. All right. So a lot of stuff is currently going on. A lot of stuff revolving around vaccination. So trying to partner with our local hospitals to make sure that we're kind of on the same page in terms of making sure that that 1A group is getting vaccinated. So that will continue on. As I said, we envision starting our clinics, if everything goes as planned, probably that week between Christmas and New Year's, and then expanding out from there. Our understanding is after we get our initial shipment of vaccine, then subsequent shipments would come on a weekly basis so that we can continue moving forward. I did indicate that we were not getting an initial shipment of the Pfizer vaccine because we did not have capacity for that ultra cold storage, but we have been able to collaborate with Ferris State University, and they may be providing us with space to be able to do that. So moving forward, we may be able to also have capacity to use Pfizer vaccine as well as the Moderna vaccine, and then waiting to see if there will be other vaccines that will be coming out that we'll be able to use. But it's important to note that whatever vaccine you are initially vaccinated with, your second shot has to be of that same vaccine. So if you start with Pfizer, your second shot has to be Pfizer, and if you start with Moderna, the second shot has to be Moderna. So that's really kind of what we have to share today. I know related to the epidemic order, that is set to expire on the 20th. And so we're kind of waiting to see what, if anything, is going to, will it be extended? Will it be changed? I have not heard anything, so I don't know what is going to happen. We did share that, there are the metrics that they're looking at now, the percent of hospitalization, percent positivity, and then the case rate or cases per million are the three metrics that are being watched to take a look at that. And so that's why we've begun to share that data with you. And as Jordan said, we'll send that out to everybody once we get done. So I believe that is the information that we have to share today. I don't know, Jordan, do you have anything else data-wise?
I do not.
Jordan, I don't know if you want to touch on the survey system that we have in place, and if anybody were to hear somebody getting a survey that it is legit, it's coming from us.
Yeah, so in the past, I guess it's been last week, we started piloting a survey system through our own survey system, which is Alchemer or Survey Gizmo. So if anyone got a text stating that they were positive and asking them to take a survey that was from us, for the time being, we have chosen to pause that as we transition into the new Patient Education Genius survey system that the state has partnered with, because it will just be a better overall working system with that and our database just going right into it. So I don't think anyone will be receiving surveys until that Patient Education Genius system is up and running.
Thanks, Jordan. And again, the reason for going to this system is because of the volume of cases that we've had to prioritize those groups that we actually are doing case investigation and contact tracing on. And so Those priority groups for us are going to be individuals up to age 22 and then 65 and older. So there's a large segment, large chunk of the population that wasn't necessarily getting contacted. And so those are the individuals that will go into this survey system, so that number one, they'll be contacted, and number two, provided opportunities for education, as well as the ability to ask questions if they have that. So that, that's a system that we've started to roll out, and we're pausing it, and then as part of a statewide effort, we'll initiate it after the first part of the year, I believe, is when it's coming out, right, Jordan?
That's what I've heard. If it's any sooner, we can let you know.
Okay, all right. So, other questions?
Hey, Kevin, I thought of one more thing I'll add.
Okay.
Just so the group knows, is that healthcare providers are allowed to sign up and receive vaccine in order to provide it to their clientele. So I just wanted to let everyone know that it will be more than just the health department providing vaccines in our communities. So I can't tell you who has signed up and how many there will be in a given county, but I just wanted you to be aware that there will be more than just health department clinics. There will be more locations than that to be able to receive vaccine, assuming it's totally voluntary. So assuming that there will be healthcare providers in each county that sign up.
Okay. Any other questions that you guys might have? Okay, if not, then that is the information that we have to share today. Assuming, we will do our call again next week Tuesday, at this time. Anticipate that if everything goes as planned, the Moderna vaccine may be approved this Friday, and we will have an idea of when we'll be getting our allotment of it, as well as how much we may be getting. And maybe able to provide a little bit more information on start dates for clinics. So if there are no other questions, thanks guys for hopping on the call with us today. If you do have questions that you think about after this, don't hesitate to reach out to us and ask. And if we need to pull you guys together before next week Tuesday because of something that's come up, we'll do that. Otherwise, everybody stay safe and take care, and we'll talk with you next Tuesday. Are there, I guess, Brett, we probably should have asked if there's other questions in the chat box.
No, I don't see any.
Okay. All right. If not, then thanks, guys. We'll talk with you later. Hey, Brett, you got a minute to stay on?
Sure.
All right. Hey, Brett, I forwarded you a couple emails, one from Dr. Whalen and one from Dr. Anderson.
Oh, hold on, Kevin. I got to hit the button. I forgot.